The most fulfilling part of my job is knowing that I can assist the patient through a very pivotal moment in their life. When patients get diagnosed with cancer, there are a lot of thoughts running through their mind, and I take honor in knowing that I have the opportunity to ease them and also help them through their treatment course. As a radiation oncologist, my job is to provide radiation as an option for a lot of patients, whether it's prostate cancer or brain cancer. And a lot of times, both surgery and radiation are an option for the patient. Now, each comes with its own set of individual pros and cons, and I want to make sure the patient fully understands that before choosing one. Radiation has come a long way. We have modern technology that's able to deliver pinpoint focused accuracy of radiation to specific parts of the body. One of the things I treat is brain cancer and malignancies within the cranium. And so we have to be very targeted when we do that. We have very specific machines that are able to do so in a very safe and effective manner. A special feature of the Brain Tumor Center here at Siteman Cancer Center is the ability to undergo multidisciplinary care with medical oncologists, surgical oncologists, and radiation oncologists like myself. And not only be able to receive the top-notch standard of care, but also to have multiple tools available at your disposal. As a radiation oncologist, I have to deliver very focused and precise radiation, and the technology matters. I discuss the treatments of radiation with patients by starting from the very basics. I talked about how it's really just light that we interact with on a daily basis, and it's things that are all around us at the same time. These are taken to much higher energy, which are then able to damage the DNA of cancer cells, and that's how we treat patients. I often liken it to other treatments as well that the patient might be familiar with, so they know what kind of side effects to experience and what they're most likely to go through when they're going through the course of radiation therapy. Every patient is different, and so the amount of radiation, the type of radiation go hand in hand, and so each patient's different. I customize my treatment specifically to the anatomy of each patient, as well as the dose and number of treatments. I sit down with the patient, we have an informed discussion, and everything is personalized to the patient that's sitting right in front of me. Just as I work with a medical oncologist and a surgical oncologist when I come up with a customized plan for a patient, I'm also working with a lot of other specialists as well, including nutritionists, physical therapists, occupational therapists. All of us work together as a single team to help take care of the patient that's sitting right in front of us and make sure that they do well during their course of therapy. By working with multiple specialists, I'm able to make sure that the patient does their best throughout the course of treatment, making sure that we can do our best to give our best treatments as well, ultimately with the goal of having the best outcome possible for each patient. Advice I would give to any patient is to really think about what they're looking for in their care when it comes to their medical problems. I think every patient should take the time to contemplate what they're looking for, and most patients are looking for the best care close to home, and I think that's something that Siteman offers. Another unique aspect of the Siteman Cancer Center is the hub and spoke model of having a lot of satellite facilities in the community. I think this is great for patients. They can come to any location and know that they're getting expert level care, whether it's at the downtown facility or another satellite facility. And they'll know they're getting the same level of excellent care from the same providers. My favorite part of every day is sitting down and talking with patients and getting to know them as individuals while they go through the course of radiation. Each course of radiation can vary in terms of time and duration, but sometimes it's up to several weeks that the patient is seeing me in the clinic and going through treatment. So getting to know my patients and getting to know how they function and what makes them happy is really important to me.